Hello, everyone. Welcome to Lakewood Health System's Well Videocast. My name is Matt Jensen, Director of Marketing here at Lakewood Health System. Today, we're going to be talking about children's immunizations and the importance of maintaining that schedule, especially during this COVID-19 pandemic. And here today to talk to me about that is Lakewood Health System's pediatrician, Dr. Neil Bratney. Neil, great to have you with me today. Thanks for joining.
Good morning.
So first question for you today. The Star Tribune reported back in May that childhood vaccinations were down significantly statewide due to COVID-19. And for certain vaccinations like measles, health officials were estimating nearly a 70% drop statewide in vaccine doses given compared to the year before. I know I've also heard information from our own system here at Lakewood that our immunizations were down as much as 40% for previous years. So, these really seem like some troubling statistics. And so could you talk a little bit about why is it so important for parents to stay on top of these vaccinations, especially during this COVID-19 pandemic?
Missing vaccinations and missing well child exams can be dangerous. We don't want children to be at a higher risk of developing additional infectious diseases like measles or whooping cough. And we don't want children falling behind on their developmental milestones. Lakewood Health System has done a very good job at safety precautions here during the coronavirus outbreak. I've talked with some other pediatrician friends of mine, and Lakewood is doing a great job. We are screening everybody that comes in for symptoms of coronavirus. We're doing temperature checks on admission to the building, and everybody in the building, both staff and visitors, are masked. And so I feel like the risk of coming to the doctor's office at this time is very low, and the concerns that you have brought up, Matt, really do need to continually be addressed for young children.
So I think one of the big takeaways, Dr. Bratney, is just really that it is safe for parents to come on in to the clinic. We need to make sure that they understand that it's still very important for them to bring those children in and stay on that routine schedule as far as these vaccinations go. Very important information. Second question for you, Dr. Bratney, is could you take a minute just to run through some of the different vaccinations that are provided here at Lakewood, and then the ages that these vaccinations are best administered to those kids?
There's a primary series of vaccinations that kids get at their 2-month, 4-month, 6-month, 12-month, 15-month, and 18-month checkups. These include tetanus, whooping cough, polio, pneumococcus, and then at 12 months we add in chickenpox and measles, mumps, and rubella. Those are boosted a few times over the course of those visits. And most of those primary shots are done by the 18-month checkup. We still have patients come in for annual checkups between age 2 through 4. And at those times, we're doing screenings for developmental progress, heights and weights, hearing and vision checks, and just the overall general well-being of the child. At the 4- and 5-year-old checkups, we offer the kindergarten vaccinations, which again are just another booster of what the child has received at the infant checkups. The last set of vaccinations that we do for children are going into either 6th or 7th grade, and those include another tetanus vaccination, vaccination for meningococcal disease, and human papillomavirus.
Okay, excellent. So a series of vaccinations there throughout those early years, and then continuing on into those the middle ages and early teenage years as well too. So important to keep those schedules and to make sure that parents are getting those children in. Finally, Dr. Bratney, if parents have questions about their child's immunization schedule, or if they'd like to come on in, if they know that their child is due for one of these vaccinations, what's the best way to go about making that happen and setting that up?
Coming in for vaccinations in well childs is still very important. Again, going over those developmental milestone and addressing teenage issues like menstrual problems or depression screening. The best way to get set up for that is with a phone call to Lakewood Health System. Families can call us at 218-894-1515, and we'll be able to get you scheduled with a pediatrician or a family medicine provider very easily. Coming up to school starting, there's a lot of going back to school checkups that are needed, as well as sports physicals that are needed. We can definitely get patients in for those before the start of school as well.
All right, fantastic information, Dr. Bratney. Thank you so much for joining me today. Have a great rest of your day. And again, thanks for spending some time with me today.
Thanks for talking with me, Matt. With me, Matt.